Good afternoon, everyone, and welcome to the fourth of our CoRE conversations. These are short, sharp lunchtime sessions for CoRE members that will happen every 2 months and are intended to dive a bit deeper into a range of topics. My name is Kate Diamond-Keith, and I will be joined today by Katrina Barraquel, our Migrant and Refugee Health Equality Advisor, Carly Myers, our Gender and Disability Advisor, and two equality advocates, Madupe and Christine. For this 101 session, there are several key concepts that we are wanting to cover. Intersectionality, what is it? What does it mean? Equality for all, and lived experience from our equality advocates. We will answer any questions if there's time. So if you want to, you can pop those in the chat. This session is being recorded, just to let you know. And you can find a copy of our three earlier sessions, Taking Action, Sex, Gender and Sexuality, and Gender Equality 101 on the WHG YouTube channel. So before I hand over to our speakers today, I'd like to acknowledge that we're gathered on traditional lands today. I'm on Wathaurong country, and I would like to pay my respects to their elders past and present. I would like to acknowledge Aboriginal and Torres Strait Islander peoples have the oldest continuous living culture in the world, and that sovereignty was never ceded. This always was and always will be Aboriginal land. And if anybody here would like to acknowledge the traditional lands that they own today, please feel free to put that into the chat. I am now going to hand over to Carly Myers, our Gender and Disability Advisor, to start the content today. Thank you, Carly.
Thanks, Kate. So, intersectionality, what is it? So, intersectionality is defined as the complex cumulative manner in which the effects of different forms of discrimination combine, overlap, or intersect. So when Kimberly Crenshaw introduced intersectionality as a theory in 1989, it was to shine a light on the compounding oppression experienced by Black American women as a result of the intersection of sexism and racism. This theory has since included other intersecting factors such as ableism, colonialisation, ageism, homophobia, biphobia, and transphobia to demonstrate how they too intersect to create interdependent systems of discrimination experienced by individuals and groups. Next slide, please, Kate. So social identities and systems of oppression intersect. And this diagram shows how the different forms of discrimination intersect with each other. On the outer circle, we can see aspects of a person's identity, which can include social characteristics such as, and I will just read a few, Aboriginality, sexual orientation, migration or visa status, religion, mental health, socioeconomic status, and medical record. On the inner circle, we can see attitudes, systems and structures in society and organizations which can interact to create inequality and result in exclusion. These include homophobia, ableism, racism, and stigma. So when these aspects or characteristics combine, people find it harder to get the help they need due to systemic barriers. There is increased risk of social isolation, and there is also a greater risk of people experiencing family violence. Next slide, please, Kate. So why do we need to include intersectionality? Well, where gender inequality intersects with other forms of discrimination, there are often higher rates of violence against women. For example, Aboriginal women are 32 times more likely to be hospitalised as a result of family violence than other women. Women and girls with disabilities are at least twice as likely to experience violence as those without disability. And women from migrant and refugee backgrounds are more likely than others to be murdered as a result of family violence. And family violence perpetrated against the LGBTIQA+ people occur at similar rates to family violence perpetrated against non-intersex, heterosexual, and cisgendered women. It is very important for CoRE members to consider intersectionality when undertaking prevention of violence against women activities, as women from diverse backgrounds are more likely to experience violence. I'm now going to hand over to Katrina.
Thank you, Carly. As mentioned, my name is Katrina and my pronouns are she, her. And part of my role at Women's Health Champions is managing equality for all. So this year we extended the project for its second round. And it's a project that raises awareness of diversity and empowers local women to be champions of change. So, as you can see on the slide, we have 9 amazing women from diverse backgrounds, and they represent women in the Grampians region across age, ability, gender, sexual orientation, culture, ethnicity, religion, language, residency status, and so on. Next slide, please. So Equality for All 2.0 is mainly here to strengthen the CoRE Alliance in its initiative to prevent violence against women and their children in the Grampians region. And we do this in 3 simple steps. So first, it's by amplifying the authentic voices of equality advocates who are experts in their own experiences. Second, with their help, we can help increase CoRE members' deeper understanding of how women experience compounding discrimination and gender inequality. And finally, through listening and learning, CoRE members can include actions from recommendations into their plans, policies, and programs, which can effectively lead to lasting positive change. Now we know the hows, and you might be asking, why is this relevant for my organization? Or why is this relevant for me? And that's a great question. All these would lead to 3 proven positive changes. First, quality talent acquisition. Second, a sense of satisfaction, inclusion, and belonging, which could lead to employee retention. And third, improving your reputation as well as increasing profits due to a more engaged workforce. And those are one of the few positive sides on just the organizational level. So, next slide, please. Without further ado, I'd like to introduce our first speaker, and she's our equality advocate, Madupe. Madupe is a Central Highlands based skilled migrant, originally from Nigeria, and a proud mother to 2 wonderful girls. She has a degree in pharmacy and is currently studying a bachelor's in nursing. She has over 10 years of combined experience in the healthcare industry and the finance sector, and she's very passionate about affecting positive change so other women will not experience discrimination based on culture, gender, language, and ethnicity. Please welcome Madupe.
Good afternoon, everyone. Thank you so much for having me here today. Like Katrina mentioned, my name is Madupe Oyekami. I currently work as a finance broker and I'm married with 2 beautiful children. Originally, I was born in the northern part of Nigeria, but my family moved to the western part of Nigeria when I was just about 2 years old. I spent my formative years in the western part of Nigeria. In October 2017, I made the decision to join my husband here in Australia. My journey began with a childhood dream of becoming a pharmacist, which led me to study pharmacy in Nigeria. I was passionate about my course and even started working in a community pharmacy during my second year of university. I gained valuable experience working alongside experienced pharmacists and even collaborated with non-governmental organizations to promote health education and organize outreach programs. However, my employment journey in Australia turned out to be more challenging than I anticipated. Today, I want to share my personal experience of finding employment and facing inclusion challenges as a migrant woman with full working rights and how this process has impacted me. I will also offer suggestions on how organizations can improve their processes and foster a culture that makes workplace integration less difficult for women like myself. After settling into the country for 2 months, I embarked on my search for jobs in the pharmacy field. It proved to be an almost impossible task, as I needed to complete a short course or have Australian pharmacy assistant experience to work in community pharmacies. Fortunately, I was invited for an interview at a community pharmacy in Turak, and I was filled with excitement as I thought this would be my first job in Australia. I performed well during my interview, and the owner even mentioned I could start the following Monday. However, weeks passed without any communication from the pharmacy owner. When I reached out, I was informed that they had chosen someone else for the role. I was eager for feedback, but unfortunately, the owner declined to provide any over the phone. Undeterred, I began searching for more pharmacies in search of unpaid work opportunities. I distributed my resume to all pharmacies in my local council and even followed up, but no one seemed willing to employ me. After months of searching for an entry-level pharmacy job, a recruitment company reached out to me with a pharmacy assistant role in a pharmaceutical company. They assured me that it could lead to a permanent position if I performed well. I was overjoyed and accepted the role. I completed my training and excelled in my work. However, on my first day, I immediately noticed that I stood out from my colleagues. Language proficiency became a significant barrier to fitting in at my workplace. During meetings, I found myself having to explain multiple times to ensure my point was understood. Despite coming from an English-speaking country, I struggled to communicate effectively with native speakers in my workplace. It felt as though I was talking to a wall simply because of my appearance. This lack of confidence hindered my ability to interact with my colleagues and express my qualifications and experience. Furthermore, cultural differences and unfamiliarity with workplace norms posed additional challenges. Adapting to Australian work culture proved to be difficult, leading to miscommunication and misunderstanding that impeded my career advancement in the field of pharmacy. Eventually, when I became pregnant with my first child, I decided to take time off work and never return to the pharmacy industry. This experience compelled me to change my career path, and I'm currently engaged in work that I truly enjoy, although my passion for health still remains. So, what can organizations do to address these discriminatory practices and create a more inclusive workforce for migrant women like myself? First and foremost, employers must recognize the immense value and potential that migrant women like myself bring to their organizations. By embracing diversity and actively seeking talents from diverse backgrounds, employers can tap into a wider pool of skills, perspective, and innovations. Organizations must also invest in empowering migrant women by providing opportunities to embrace their language skills through language programs, mentorship initiatives, and targeted support. These measures bridge the communication gap and enable women to compete on an equal footing. Furthermore, businesses and organizations need to implement fair and unbiased recruitment processes. By raising awareness of unconscious biases and embracing inclusive hiring processes, employers can ensure that every candidate, regardless of their ethnic background, is evaluated solely based on their qualifications, skills, and potential. In conclusion, it is imperative that we confront the discrimination faced by migrant women in the Australian workforce. By fostering inclusive workplaces, addressing language and cultural barriers, and challenging biases, we can unlock the immense potential of migrant women and build a truly diverse and prosperous society. Let us embrace diversity, reject discrimination, and work together towards a future where every migrant woman as equal access to employment opportunities and the chance to fulfill our professional aspirations. Thank you so much.
Thank you for sharing your experience on accessing employment that matches your skills, expertise, and achievements, Madupe. Your story highlights the feelings of further displacement and not belonging when your qualifications are questioned, especially when your work environments are not culturally responsive, safe, and diverse. And it's a good thing to point out that knowing English is different from being well versed in Australian English. And that poses a barrier as well, which reminds us to ask these questions as an organization. Who is not present in our talent pool? And what can we do to attract and retain these quality professionals? So, our next speaker today is equality advocate Christine. Christine is a Central Highlands based woman with a disability. She is a qualified, ever so qualified historian and was recently accepted into a PhD program. She has decades of combined experiences in the following industries: real estate, community based education, finance, and aviation. Amazing. Christine is passionate about affecting change so women will not experience discrimination based on age, gender, physical appearance, and religion. You have the floor, Christine.
Thank you so much for being here today, everybody. Picture this: you walk into a healthcare facility seeking medical attention only to be treated differently because you're a woman. Unfortunately, this is a reality that many women in Australia face every day, and I want to discuss the pressing issue of discrimination against women in healthcare and what could be done to eliminate it. I need to share with you my personal experience with discrimination in healthcare services. I had an accident New Year's Eve 2018 that resulted in the loss of the use of my leg, and I spent almost 12 months in a wheelchair, had to learn to walk again. For years, I've been trying to access specialist clinics, medical diagnosis, and information about the treatments I'd received through local healthcare services, but I've been largely ignored and denied access to medical help. Sadly, this neglect has not been confined to just one department and has been an institutional-wide neglect. It's been a wide-ranging issue from being denied physiotherapy after a serious accident and surgery to having doctors ignore me and disregard my pain in outpatients departments, being denied information about what surgery was conducted on me and what the diagnosis was, being threatened with expulsion from a falls and balance clinic because I was not improving enough, being denied access to a psychologist when I sought an amputation, not once, not twice, but 3 times, and having access to pain doctors in a pain clinic denied me. This meant that although I was not working and had no government assistance, I was forced to pay for private medical professionals outside of my local area. And unfortunately, my experience is not unique. Discrimination in healthcare is a significant issue, especially for women, and it's important that we acknowledge and address it. I was made acutely aware of my intersectionality. I was a woman, over 50, overweight, and disabled. Medical professionals could not manage one of these issues, let alone all of them at once, yet that's their job. As women, we face unique challenges in accessing healthcare. According to a recent report by the Australian Institute of Health and Welfare, women experience higher rates of chronic disease and disability than men. Yet, despite these higher rates of illness and disability, women face significant barriers to accessing healthcare services. For example, it takes women many years longer to achieve a diagnosis compared to men. Women, especially women who are disabled or over 50, are not being taken seriously, with many of their symptoms being blamed on their menopause or their weight. This can lead to delays in diagnosis and treatment and ultimately poorer health outcomes for women, as it did for me. I was made to feel like a hypochondriac, and it became a full-time job to advocate for my health. With the help of my son and his continued presence at my medical appointments, attitudes towards my symptoms changed somewhat. It seemed that bringing a white male person with me afforded me a better experience. They found it harder to ignore me when he was present. However, I'm still invisible when I'm alone, trying to access help within these services. In fact, the invisibility is so pervading that in my case, it took more than 5 years for an autoimmune disease to be diagnosed. The eventual diagnosis only coming after I was forced to travel to Melbourne and pay for a private specialist. It took local medical services more than 3 years to advise me there was a pain clinic at the hospital, for them to tell me that I wasn't eligible to be seen by them. I overcame each and every hurdle they put in my way and continued to battle to be seen. To be accepted into the pain clinic, I was made to do 10 online modules about pain and pain management, obtain an internal referral, which was difficult when no doctor would see me. I was eventually sent to a geriatric specialist who arranged tests, only to be sent to a rehabilitation doctor. But I was never made aware there was a rehabilitation doctor up until that point. I was then put on a waiting list, only to discover 7 months later that I was forgotten about and had to start the process all over again. Some 4.5 years later, I finally had an appointment for the pain clinic. During that nightmare, after accessing my health records under the Freedom of Information Act, I became aware of who had operated on me in 2019 and the errors in my medical records. For 12 months after my accident, someone had to take me to every medical appointment, so I had witnesses to each and every event. I complained at every appointment that I was unable to feel my left foot. And in one 22-minute appointment, I complained for 13 minutes. My carer timed it. You can imagine my horror to see in my records, patient reports no sensory loss. Furthermore, one orthopedic surgeon claimed they'd cut nerves to my foot during surgery, yet this was missing from my records, although it would certainly account for not being able to feel my foot. I was not failed once or twice, but literally hundreds of times, and it must stop. Women deserve to be taken seriously, and women's voices must be heard. Medical institutions must ensure that women are able to access the health services that they require, and that these services are responsive to their unique needs and concerns. They must ensure that those unable to travel long distances or unable to afford private consultations are not at peril of their health deteriorating even further for being unable to do so. Healthcare should not be for the wealthy and privileged and the able. It needs to be for everybody. Women with disabilities, women of colour, trans women, and women from other marginalised groups face significant barriers for accessing healthcare services. There are several ways that doctors and hospitals can identify and prevent discrimination against female patients. Firstly, they must provide training to healthcare professionals to help them recognise and understand their unconscious biases and how they might manifest in their interactions with patients. Secondly, hospitals and clinics can collect and analyse data on patient experiences and identify any disparities in treatment or outcomes between male and female patients. This can help identify patterns of discrimination and highlight areas for improvement. Thirdly, healthcare providers can ensure that their facilities and services are accessible to all patients, regardless of their gender or other demographic factors. Fourthly, hospitals and clinics can establish clear policies and procedures for handling complaints of discrimination or bias. Patients should feel comfortable reporting any incidents of this, and the complaints procedure must be transparent and accessible to all. It is essential to raise awareness of the problem and to highlight specific instances where discrimination has occurred. This can involve sharing stories and experiences from women who've been affected, as well as providing data and statistics that demonstrate the extent of the problem. By empowering patients to advocate for themselves and demand fair treatment, healthcare providers can help create a culture of respect and equality within the healthcare system. Institutions must be held accountable for their actions. When large institutions fail to recognise their discrimination against women, it can be challenging to bring about change. In closing, we need to work together to ensure that everyone has access to healthcare services that they need and that their services are responsive to their needs and concerns. I challenge you to listen to us so that we can tell you what we need.
Wow. Thank you for sharing your experiences on accessing healthcare services, Christine. Your stories certainly highlight several structural barriers leading to negative outcomes. And on the top of my head, I can think of three. First, women distrusting the healthcare system, which is something we don't want. Second, women taking responsibility for advocating for their own health outcomes, like you mentioned, without systems of accessible support. And that requires the privilege of time, money, and energy, something that simply isn't possessed by all in different phases of their lives. And third, sadly, that could lead to women foregoing care or missing out on treatment options altogether, which reminds us, if we are part of healthcare organizations that provide these services, where are women seeking help? And why don't they come here anymore, if at all? So for more in-depth information about about our intersectionality guide, I give the floor back to Carly.
Thanks, Katrina. Just wait for the slide. Thank you. So the Intersectionality Guide, it's a tool for CoRE members. Developed as part of Women's Health Champions Equality for All project funded by the Victorian Government. This guide supports you as members of the CoRE Alliance to address how gender equality and other forms of discrimination intersect. It provides examples of scenarios, questions, and actions on how to apply intersectionality across several settings, such as organizations, organizational structure, leadership and management, human resources, programs and services, facilities, and policies. Next slide, please. So applying intersectionality. So using the guide, we understand how women and men have complex identities and different groups of women will be affected or disadvantaged by programs, systems, and policies differently. So when we are thinking about taking action on gender inequality, we also need to be consciously considering and addressing these additional barriers. It is also important to be aware of our unconscious bias and about not to make assumptions about people. There are 5 principles to consider when applying intersectionality. They are learn, listen, openness, reflect, and apply. Next slide, please. So accessibility for all, safety and respect for women with disabilities in Ballarat. So this project has been funded by the City of Ballarat and Department of Justice Empowering Communities program. This project will enable the voices of women with disabilities in Ballarat to address discrimination and ableism in community spaces and within organisations to create a city where women feel safe, respected and valued. And co-design is key to this project. We are working with 3 of the Equality for All advocates whom have lived experience of disability. And Christine is one of them, and the other 2 are Annabelle and Heidi. They are helping to develop an action toolkit for CoRE member community groups and organisations about taking action that is inclusive of women with disabilities. The action toolkit will include training and support of how to use it. And the last part of the project will be a positive community campaign about community safety in and around the Ballarat region using an empowerment model. This will be launched via social media on the 3rd of December to mark International Day of Disabled Persons, which also falls within the 16 days of activism against gender-based violence. And I hope all the CoRE members here today will contact us about this wonderful project. Thank you. Back to you, Katrina.
Thank you, Carly. We're aware that the information that you heard here today can be either exciting, overwhelming, or both. One thing you can do after leaving this session is to think about when you can have an audience with our team. So when you need to get your point across, our equality advocates can offer a range of perspectives that you can listen to and learn from. And so, how can you book them? It's easy in a few simple steps. A range of platforms will be used to share their stories. Let us know if you want them to join you in person or online. Think about what kind of event you have. Is it a leadership briefing, a meeting, a training? Let us know so we can align our goals and our equality advocates can tailor fit their speeches to share something relevant that you can use. And which perspectives do you require? And one way to think about it is which of our 9 advocates do you want to hear from? And if you need more information, visit our website or contact Kate and myself. But if you know exactly what you need, complete our booking form and the links are below. They will be available in chat. So back to you, Kate.
Thank you to all our speakers, and particularly thank you to Christine and Madupe for sharing your lived experience. I hope everybody learned a lot from Christine and Madupe. We're finishing up now, so thank you so much for coming along today. I'm going to put some links in the chat in a minute. One of them is to join our CoRE Friends Network, so please consider joining the CoRE Friends Network. And just a quick promo that the next CoRE Conversations in August will be covering sexual and reproductive health in more detail. So I'm going to stop recording in a minute, but if anyone wants to stay online and have a chat or ask any questions, please feel free to do that. And I'll put some links in the chat now. So thank you everybody for coming.